Hey everyone, so today's class is going to be hip and knee focused, and we're going to be exploring fundamental motion for both of those joints. Fundamental motion for the hip and for the knee, both being rotation. So we'll start out in a side lying position, of course, to warm up with our cars. So I'm gonna come to lie down on my side. I'm using a block kind of as a little pillow for myself. Shoulders are stacked, arms pushing forward, bottom leg is straight and pushing away from you. If you do need to bend that bottom knee, it's okay. And then we're gonna go through a few hip cars from here. So go ahead and create some tension. I squeeze that knee all the way up. I externally rotate and I abduct out to the side so my knee goes towards the ceiling. When I can't go this way anymore, I start to rotate internally. So knee comes towards the center line of the body. Keep an eye on that lower back, make sure nothing is moving. I've got some blocks in my way here. I'm gonna push behind me with that foot. Knee comes out, I go all the way up and all the way back to the starting position, and I let my leg, or I'm trying to squeeze my knee towards the floor as well for a little bit of adduction stuff as I come back down. Again, all the way up, all the way out. Internally rotate, watch that lower back, make sure it's not moving. I can't really extend from here because these blocks are in my way, but you're gonna push behind you with that foot, making sure not to extend in the lower back. Your knee comes back up towards the ceiling, and you squeeze it across the center line of the body there to come back down again, up, out, in, and behind. We're gonna go for 5. Here we go, so this is 3, yeah? This will be 4, we squeeze all the way up, out. Keep your abs nice and tight. If it helps you to think about bracing your core so that you're not moving that lower back around, that might be helpful. All the way back up. You can also place a block behind your lower back if you feel like you're really wobbling around a lot. Okay, last one. Let's go all the way up, all the way out. Squeeze to find that internal rotation. Fight for more as you come towards the center line. You push behind you using the glute and the hamstring. You bring that knee towards the ceiling. Flex all the way up. And you squeeze that knee towards the center line to come back down. Nice, that's our 5 on that side. Let's go to the other side. I think I'll have space on this side. Let's see. Okay, so head down, arms forward, create your base, solidify everything, and let's go. Squeeze that knee up. Out. Look for the end, yes, the first one on this side. Rotate internally, knees come together. I push behind me, make sure the abs stay nice and tight. If your ribs are flaring out like this, that means your lower back is working more than it should. All right, we come back the way we came. All the way down, there's 1. Nice and slow, controlled movements. Like, look for different sensations in the hip. Yeah, the point is to look for the end of where you can go, make the biggest circle possible while always staying pain-free, but feeling for the edges of where you're able to move. Here we go, push behind. Knee comes up and back down. Nice, that was 3, let's go 2 more. Up, out, squeeze in, push behind, knee comes up. So from this extended position, yeah, you keep that extension, you start to bring that knee back up towards the ceiling, and then you come back the way you came. Biggest circle possible. You might notice it gets bigger as you go. Once your brain kind of figures out what's going on, you might be able to make that circle a tiny bit bigger. Squeeze the whole time, push behind you now. This is the last one. And back to the starting position. Nice. Go ahead and help yourself up. We'll move on to our knees and our ankles. So we'll do our knees just the standard way for now, meaning I'm going to place the same arm under the working leg, grab that opposite bicep, and then this hand is going to go on top of that shin bone. I kickstand myself back, or kind of rock back. If you need to lean up against a couch or something here, obviously that's fine. All right, let's go. We'll start with external rotation, so externally rotate. Fight for that as you go all the way up. Internally rotate. Fight for that as you go all the way down. Remembering to keep tension the whole time. Squeeze out, up, in, slowly down. This is going to be 3. And the reps are each direction, yeah? So this is 4 in this direction, and then we have to do 5 in each. One full rep is both ways, right? So let's go. Other direction now. Internally rotate all the way up. Externally rotate. Fight to keep that as you slowly go all the way down. Squeeze in, lift, up, out, slowly down. Again, this is 3, and you might not extend a whole lot. That's fine, especially if you're new to doing this. Just work within where you are able to extend that leg and try to fight for a little bit more as long as it's pain-free. Yeah, this will be our last one on this side. And then let's do our ankle since we're already in this position, right? So go ahead and point that foot down. Invert in, so outside of the ankle rounds away. I bring my feet up, I flex it up. Point my toes as I start to tilt the inside of my foot away from me, all the way around. And I'm not going to give too much coaching here. This is more of a follow along thing. So if you need a more detailed explanation, you can always go back and watch the videos on these. Yeah, here's 4 and 5. Let's go the other way. For 1, 2, and I notice a lot with these, especially people, especially at the start, it's more like a square. So you're looking to make a nice smooth circle in each direction, finding the ends of where your ankle can go. Nicely done. Let's go to the other side. So knees first, same arm under that leg. Go ahead and help yourself back if you need to. That hand on the bicep, this hand on top. External rotation first. I'm going to twist out from that shin bone. Try and keep that as I lift all the way up. I extend my knee as much as I can. Internally rotate. Fight to keep that as you come all the way down. Rotate again at the bottom. We go all the way up. In and down. This is 2. 3. Oh, I'm a little bit sore in my hamstrings today. 4 and 5. Nice. Let's go the other direction as well. Up, out, all the way down. In, up, out. Fight for that as you come all the way down. I'm creating tension the whole time, yeah? Even if it doesn't look like it, I'm squeezing a lot, especially on the external, because for me, that's the one that's a little bit worse. Okay, last one on this side, and then we'll do our ankles. So from this position, we're going to stay here and do 5 ankle cars in each direction. So I'm going to point that foot down, squeeze it in, center line of the foot, or sorry, inside of the foot comes towards the center line of the body. I flex up, I push away from me, and then I go all the way back down. So we'll go for 5, 4, 3. This ankle for me is a little bit worse. 2, then the other one, which is always kind of the case. You'll notice, let's go the other direction, that one joint always will either feel a little bit better or a little bit worse than the other side, and that's totally okay. Here's 3, 2. There's no such thing as like a perfectly symmetrical person. And that was the last one. Yeah. So go ahead and rest. That was our cars done. So that's our warm up done. So Mimi's has joined me now. We're going to do our first set of pails and rails. So we're going to set up in a bear sit position. Okay, so I'm gonna have my heels out and I'm gonna scoot my butt forward. Or if that's not possible for you, you can also sort of orient yourself forward, because you do need to somehow be able to create tension by pushing the elbows or the forearms down on those knees. So what you could do potentially is, if this is very difficult for you or uncomfortable, you could sit back and lean onto something and then use your hands. That's another option. Yeah. So go ahead and set yourself up. And we're going to be here for 2 minutes. So while I'm here, I'm thinking again about pushing those knees away from me. This is a bit of abduction and internal rotation stuff that we're doing, yeah? So, or sorry, external rotation. So pushing down my knees to the floor. Now, if you feel something weird in the knees here, the first thing I'll ask you to do is make sure, obviously, that it's not painful. Second, if it feels a little bit weird, it's just like a little twingy sensation, I'll get you to kind of point the toes down, facing forward, and see if that alleviates that at all. If it doesn't, maybe come slightly out of the position and find where you can work without there being any sort of weird sensation in the knees. Okay, so we are about 45 seconds into this stretch. Remembering when we're here, we're just trying to chill and find our happy place. Okay. See if you can get a little bit more. And what we're going to be doing here is the PALS effort is going to be driving those knees up and into the hands, as if you wanted to do this, but of course we're not going to let them move, right? So we always stay at the end, unless there's something going on, obviously, in which case, of course, you can come slightly out of the position. So the PALS effort here is going to be you pushing up and in, and the RAILS effort is going to be you trying to squeeze. So this effort is going to come from this stuff on the side of your butt, trying to pull your knees deeper into the position. Okay, that's going to be your RAILS effort. So we've got about 20 seconds left. So find your position. Try and relax as much as you can. And I'm just going to move my timer here so that it's easier for me to see. Okay, so we're at about 2 minutes now, so go ahead and take a nice deep breath in. And pack that air down into your belly, create tension in the whole body, and you're going to start to drive those knees up into the hands or into the forearms or the elbows, wherever you're working, yeah? You start with a light effort, and you're building it up about now to a medium effort. You're going to push a little bit more and a little bit more. You're going to find your hard effort, making sure everything feels okay, nothing is painful. Push as much as you can. Let's go. 3, 2, 1. Now pull away. Act like you could pull those knees down and away from your arms or your elbows, whatever you're using. This is the outside of the butt stuff here. Pulling down, squeeze. Squeeze even more. Even more. Even more. And about now, I want you to find your maximum safe effort. You're going to hold it for 3, 2, and 1. Nice. Go ahead and relax. We're going to go 1 more minute and 1 more round of the isometrics. This little buckle in my mat is bothering me. Okay. So adjust your position if you need to. Find that stretch on the inside of the legs here. You might also feel it up here in the hip. And then you can also increase the stretch, by the way. Sorry, I'm moving myself forward because for me, I feel it more if I come here, okay? If this is too intense, you would lean back, and this would be a different way to adjust. Yeah, so let's go. 25 seconds in. Find your belly breath, try and relax. My cat is making biscuits on my bed. Okay, we're 45 seconds in, so we've got 15 seconds left, and then we're gonna do our PALS and RAILS again. Okay, last few seconds of relaxing time. And about now we're at 1 minute, so go ahead and take 1 deep breath in. On the exhale, you create tension in the whole body, you solidify, start to drive those knees up into your elbows, your hands, or your forearms, whatever you're using, push. Light effort. Medium effort. Strong effort, okay? Now find your maximum safe intensity. Push as much as you safely can. Let's go. 3, 2, 1. Switch. RAILS effort. Pull away. Try and pull those knees away from your forearms or your elbows. Squeezing them down towards the floor. You should feel the stuff on the side of your butt light up. Go pull a little bit more. More. And about now, find a strong effort, pulling those knees down as much as you safely can. Let's go, hold it. 2, 1, very nice. Go ahead and relax. Now before we move on, we're just gonna do some little capsular cars from here. Now I'm gonna lean back, okay? If you need to, so the more you lean back, the more you're gonna find maybe it's a little bit easier for you to rotate the hip, and the higher up you come, it's gonna intensify that and make it a little bit harder or more challenging, yeah? So let's go ahead and just do a couple capsular cars from whatever position you like to see where you are able to rotate that hip. Now, squeeze one leg at a time, all the way down, and you're looking for how far you can move with just the hip. So if the pelvis or the spine starts to move, it's gonna look like this, okay? So that's the difference. So you find your internal rotation, and then you're gonna try to find a little bit more. You're gonna squeeze at the end, and then you're gonna do the same thing for the external. So now I'm driving that knee away like I wanted to push it towards the floor, and I'm gonna fight for more there. I squeeze, and again, let's go in. This leg is also active, yeah? Squeeze at the end here, squeeze at the end, externally. So I'm fighting also with the opposite knee to push it down towards the floor and keep it in that position so it's active. Okay, let's go one more on this side. Squeeze in and squeeze out. Very nice. Other side. So now this leg is going to actively push down, and this one's going to rotate internally. Find the end of where you can go without that pelvis moving or hiking up. Give it a little squeeze, and then externally rotate. Push it down towards the floor. Again, in, squeeze, and out. Find the end, look for a little bit more, squeeze it. That's good. Let's just do a couple more here. I'm not necessarily putting a specific number on it. We just kind of want to play around with where it can move and look for different sensations that are happening in the hip and try and differentiate the hip from the pelvis especially. Here we go, squeeze and squeeze at the end there. Very nice. Okay, so next we're actually going to do internal rotation of the hips from this position. Now, I've got a band here and it's a small one. Ideally for this you would have a bigger band, but since this is sort of our basics session, I'm not going to use a bigger band just because I want everyone to be super, super safe. This is more just to give a little bit of feedback as to which direction you're moving and less about actually creating a block for you, if that makes sense. So I've just created a little loop, yeah? And then I've fed the long end of the band through that loop to loop it around my leg just above my knee. Now what I'm gonna do is I'm going to find the same position that we were in before, the bear sit, but now I am going to find that internal rotation just like we practiced with the capsular cars. And then I want to look for the end of where I can go there. That's going to be where we do this position from. The only difference is that I'm going to use this foot to block out that band. Okay, so you've got your little loop going on here. I'm gonna feed the end of that band under the opposite foot. And then go ahead and send this leg out to the side a little bit so that you can get a bit more tension. You can adjust however you need to, yeah? And then we're going to let the band take that leg into internal rotation, yeah? You see here, I need a little bit more tension here on the band. There we go. Okay, so your legs are quite strong, which is why I would say normally if we're doing this and we're actually using the band as a block to block out the hip, you would want to have a heavier band than this. But again, this is kind of just to figure out, this is more for like resistance purposes so that you can figure out what the contractions for the internal rotation of the hip feel like. So we've got 2 minutes here. And what you can do is you can always like readjust, right? If you need to go a little bit deeper, you can. Oh yeah, this is nice. Here we go. And now we're just relaxing, yeah? This is our passive stretch, so we're chilling. You can think about your life and your life choices. Same rules apply for the knee here, yeah, as well. So if it feels a little bit funky in the knee, go ahead and point that toe a little bit. If that doesn't alleviate it, come out of the position slightly, see if you can do work there. You're looking for where you can work always, right? Without other stuff feeling weird. Okay. 45 seconds in, continue to breathe. And when you're doing this, yeah, we're really looking for the sensation to start to intensify a bit here. It's more like in the side of the butt and then like the crease of where your thigh is going to meet your hip. Okay, we're 1 minute in. We've got 1 more minute to go. So you can continue to relax, and I'm just going to explain the pails and rails effort from here, yeah? So keep breathing, stay with the breath. And the first effort is going to be us trying to drive that knee out like we're resisting where the band is, right? So when we do our pails effort, I'm gonna be trying to externally rotate. And you shouldn't actually be able to move a whole lot. This is what I mean about we're not using the band for a block. So what you might actually need to do is place a hand there so that nothing actually moves. But just having that band for resistance so that you can feel, okay, I'm going this way, right? I'm trying to externally rotate. Nothing's gonna actually move, so stay at the end and you're gonna push out. Now, the rails effort is you're going to think about going with the band as if you wanted to slacken or give it a little bit more space, right? So you want to internally rotate even more, and you're really gonna feel that up here in the hip. Okay, so those are our efforts. We're at about 2 minutes now, so go ahead and take a deep breath in. And solidify. Go ahead and block that knee out with one hand if you can. And we're gonna push. Yeah, if you are using a heavier band, you might not need to use the hand. So find a light effort, trying to push that hand away, push the band away with the hip. Build it up now to a medium effort. Push a little bit more. Good, and about now you should be hard effort, strong effort. Push, push, push. Hold it for 3, 2, 1. Now we're going with the band, rails. Try and pull down as if you could slacken that band. Don't let anything else move. Yeah, make sure especially that the pelvis doesn't dip forward. Pull down from the hip. And strong effort now. Hold as much as you safely can. Pull down for 3, 2, and 1. Very nice. Relax. We go 1 more minute and 1 more round. Time is going. If you need to adjust yourself, yeah, like for me, I think I need a little bit more resistance on that band now. Probably get a little bit more space after that first round. Feel free to adjust yourself, and the timer is on. Nice. Okay, good. Again, you connect with the breath. Try and relax as much as you can. Let that hip go in. Make sure the pelvis doesn't come along for the ride. And just try and let it sink into that position. Okay, we're about 20 seconds in. We've got 40 seconds left, and then we'll do 1 more round of our pails and rails. Nice deep breaths into the belly. Let the belly be soft. Relax as much as you can. If you need to lean up against something, also you can, just so that you're not always leaning back on your arms. You've got about 15 seconds left before we go, yeah? So keep relaxing for now. See if you can go a little bit deeper. Check in with that knee as well. Make sure the knee is feeling okay. And let's get ready. Deep breath in. Exhale, very light effort. Start to push away from that band. Block it out with the hand if you need to. Push away. Good. Find your medium effort push. Push a little bit more. You're going to dial it up now to your maximum safe effort and hold it. Pull away. 3, 2, 1. I'm shaking. Good. Pull down and in. So try and slacken that band by internally rotating the hip even more. Pull, 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 pull. Medium effort now. And strong effort. Make sure everything is safe, but pull as much as you can. Let's go. 3, 2, 1. Nice. Now slowly relax. Woo! Spicy, spicy, spicy. Go ahead and do a couple capsular cars just like we did before. Don't worry about the band. That's for later. Yeah, gentle, easy ones for now. We are going to come back to this and do the rotations with the band in this exact position, but we will do that after we've done the pills and drills on the other side. Yeah, we're going to give this one a little bit of a break first. So go ahead and set yourself up on the other side. So again, I loop this around just above my knee, and then I'm going to feed the long end through, and then place this side of the band underneath my foot, help myself back, slide that foot out, and then start to find my internal rotation on this side. Okay, so let's go find your position. I'll give you another couple of seconds to adjust. I also need to adjust a little bit. Here we go. That's good. And I'm going to put the timer on now. So on this side, I do also feel the knee a little bit. So I'm going to come slightly out of that. There we go. That's better. Okay, so we've got the timer on. Connect with your breath. Try and relax as much as you can. And if you find you can go deeper, sometimes you'll notice as well, like sometimes if there's a weird little twingy sensation in the knee or somewhere else, it might go away as you go on. Yeah, the longer you spend in that position, you might see that that sensation kind of goes away. So it doesn't always mean that there's something wrong, right? If you feel a weird little sensation, it might just be that your brain needs to figure out that it's okay for you to be there, right? So if you find that like now that sensation in my knee has gone away, I'm gonna pull my hip a little bit farther in, and then I'm gonna pull this band a bit closer with my foot because now it's fine. Ugh, yeah, that's a little bit gross. Okay, we're a minute 15 seconds in. We've got 45 seconds left. My pelvis is wanting to lift up on this side as well. And we keep going, yeah. We've got 40 seconds left. Try and relax. Nice deep breaths in. Make sure you're always breathing in and out through your nose, yeah? We're not trying to activate anything here. We're trying to relax. So try and keep a nice deep breath in and out through the nose. Coming from the belly and also not from the chest, yeah? We've got 10 more seconds and then we'll do our pills and reels. Perfect, so about now, go ahead and take your deep breath in. Create that tension internally by squeezing everything. Solidify. Start to push out, yeah? If you need to use the opposite hand, go ahead and place that hand there and start to push out like you wanted to move that band away. All right, a little bit more. Oof, this side is much worse. Ugh, a little bit more, push more. And about now, find a strong effort. Yeah, push. 3, 2, 1. Nice, pull down. Try and slacken the band by internally rotating the leg even more. Ooh, this side I feel it a lot. Good, more. Medium effort now. Pull as much as you safely can in 3, 2, 1, and then we're gonna hold that strong effort also for 3, 2, 1. Nice. You can relax for a sec. If you need to readjust yourself, I'm gonna need to kind of readjust my position here. Feel free to take a second, have a sip of water as well if you need, and then we'll go for our second round. Yeah. So I've got my setup here, and timer is now on, so 1 minute. Yeah. Again, connect with the breath, relax. We're chilling. Just feel for the sensations in the hip. For me, this side is much more intense than the other one. The right side is always pretty easy when it comes to the internal rotation, and the left side, I always feel it. So it's really important for me to do a lot of internal rotation on the left side. This is the other good thing about this system, is that because you're always learning about yourself, right? And you know kind of what's normal for you and what's not normal for you. And as time progresses, you're also going to figure out where your weak points are, and you'll know how to address those things, right? So you're not just going to be kind of wondering why things feel weird. You'll actually have some tools in a toolbox to help you figure out what's going on. Okay, so we've got Just a few more seconds, so let's go ahead and take a deep breath in. We solidify. You place that hand if you need it, and then you're gonna start to drive that band away. Yeah, remember this way. Push out with that hip into that hand. Build it up a little bit more. Always stay super present with whatever sensations you've got going on. Yeah, we're not trying to push through pain. It can be super disgusting and uncomfortable, but not painful, okay? Build it up now. Safest, strong effort. We hold it for 3, push, more, 2, 1, and then slacken that band. Try and rotate internally even more. Nothing should really move. Ooh. Pull down, pull down, pull down. Try and create slack in that band. And find your strong effort about now. We're gonna hold it for 3, 2, and 1. Very nicely done. Very slowly come out. Yeah. Woo. Goodness. Okay, and then we're gonna do a few capsular cars from this position. Yeah, you can leave this band for now. If you're brave and you want to do the banded rotations on that side, that's obviously fine, but I like to give it a little break in between. So now we're gonna find our true bear sit. Okay, so I'm gonna pull my knees farther out, away from one another, and then I'm gonna rotate that knee in, find the end of where I can go. I give it a little squeeze. And then I rotate out, and I give that a little squeeze too. And we go again. Internally rotate. You're gonna feel that internal rotation of the hip. Externally rotate. You find your end, you look for a little bit more, you push, squeeze, and then you go again inside. Good. Focus on what you're feeling. See where you're feeling everything. You should be feeling it a lot in that hip and the crease here and on the side of the bum. And out. Okay, nice. So now we will actually do our banded rotations. Yeah, we're gonna set that up the same way we did before. Of course, if you're short on time and you want to go ahead and do it before, yeah, if you want to do it while the band is already there, because that kind of makes more sense in terms of like setup situations. What am I talking about? Setup situation, you know what I mean. Then, because you're already there, right? Feel free to do that. I just set it up this way for today because I want each side to have a little bit of a break and not be too intense, right? So now we're looking for a little bit of resistance from the band, but I do want to be able to move it. Yeah, now you're gonna scoot your butt forward a little bit, send your hands behind you, and now I've got not enough slack. I need a little bit, or I've got too much slack. Here we go, I've got not enough tension. So I'm gonna now do those same capsular cars, but with the band. So you're gonna feel a little bit of resistance as you push out and away. Push that knee down towards the floor. Give it a little squeeze. Find the end, squeeze it, and then internally rotate. The band's gonna slacken a bit, but you're still creating that tension. Come in as much as you can. Give it a little squeeze. And then externally rotate again. Give it a little squeeze at the end. Nice and slow. It's like you're trying to own every inch of space you've got. Squeeze in, slacken the band. Squeeze out, resist the band. Let's just do a couple more. Again, here, I'm not really doing this for any particular number of reps. I'm just doing a few to feel out that new space that I've made in my hips and tell my brain that I'm gonna use it. And the capsular cars, or any of the cars really, are what save the work that you just did. Okay, so we're just kind of feeling out that space. This will be the last one. Woo. And showing the brain that we're gonna use it. Yeah, so we don't want all of that effort to go to waste. We want to do our cars so that everything is nice and juicy and we save all of the work that we did. Yeah, so go ahead and set yourself up on the other side. Yeah, band under the foot. Scooch that leg up. And then find where you can work. Yeah, you can always adjust the band to have less or more slack based on what you feel. So I'm gonna go ahead and squeeze out. I'm gonna find the end of where I can rotate externally. I hold it and I fight for a little bit more. And then I internally rotate. That band's gonna slacken a little bit, but I still squeeze the very end of where I can move, and I look to see if I can go a little bit deeper. Again, out, give it a little squeeze, and in and give it a little squeeze. Ooh, out, little squeeze. In, little squeeze. Always feel free to like adjust anything you need to do, yeah? If you need to pause the video and adjust your band, or you feel like one side is a little bit crustier than the other side, you want to do more on one side, that's totally cool, yeah? Out. In, fight for more. This will be the last one. We go out, squeeze, and in and squeeze. Oof, nice. Okay. So hip stuff, mostly, except for the cars, of course, at the end is done. We're just gonna go ahead and move on now to our knees. Right, so now Bruce has joined me, so we're going to do our knees, okay? So to do our knees, essentially, we're going to start with the external rotation, right? So when I'm externally rotating the knee, this bone, the shin bone, is gonna turn out and away from you. And you want to keep the foot, now we have macaroni, flexed up as much as possible. This is super important, yeah? So where you feel this the most is also gonna depend on the amount of flexion you are in. I'm going to be working kind of in a mid-range position, but when I'm doing this for myself, I need to flex up more because this is where I feel it more, okay? So when we're doing this, we're gonna be kind of in the same position, a bit like a bear sit. I'm just gonna get my timer ready here. And then I'm going to wrap my arms around the outsides of my legs, and then my palms are gonna flip towards my feet and grab the inside, and I'm just gonna very gently pull away with my hands so that I've got a bit of sensation here on the insides of the knees, yeah? Take it super easily and gently here, because most people have never trained their knees before, so you're not really familiar with what kind of sensations are okay and which kind of sensations are not okay, right? So be super mindful when you're pulling out here that everything is feeling okay, nothing is painful, obviously. All right, so we're about 20 seconds in. We're gonna keep relaxing into this position. If you find you can get a little bit more, get a little bit more. And always fight to keep the feet flat, yeah? Try to never round the ankles in. It doesn't happen so much in this position, but when we do the internal rotation especially, the ankles are gonna wanna kind of jump in and cheat, okay? So keep breathing. And I've got Mr. Muffins. Come. My Mr. Muffins is here. He's gonna keep me company while I do this. Hi, baby. Nice. Okay, we're 1 minute in. We've got 1 more minute left. I'm gonna take a break to pet my cat. Nice. Baby. Okay. We've got about 30 seconds left, yeah? If you want to as well, you can also adjust yourself by scooching your butt forward or back, yeah? Just make sure you're keeping an eye on the sensations in the knees. Everything's feeling okay, all right? When we do the pails and rails as well, I want you to start out super gentle and you ramp up super, super slow. Yeah, for the same reason. A lot of us don't have a lot of experience here, training here. So if this is your first time especially, you need to really, really be careful, yeah? So let's go ahead and take a deep breath in. On the exhale, I create tension in the whole body. I'm gonna start to push my feet into my hands. And this is so gentle at first, yeah? You really need to feel out what you're doing with this. Build that tension up a little bit more, okay? So I'm trying to do this. I'm trying to push my hands towards the center line of the body with my feet. Okay, a little bit more. We're gonna do a longer hold here, but with less intensity or less effort actually. So push more. And then about now, I want you to find how much you can safely push and hold that for 3, 2, 1. Now we're gonna switch. This is the rails effort. I'm keeping my feet flexed up. I'm gonna squeeze my feet away from my hands as if I wanted to escape my hands by externally rotating my knees even more, okay? So let's go, build that up slowly. Again, we go for a little bit longer here to give your brain time to figure out what I'm asking it to do. Squeeze a little bit more. Ooh, spicy. And about now, hold it as much as you can safely pull. Pull and hold it. 3, 2, 1. Very nice. If you need to relax for a second, go ahead and relax. Rotate those knees in and out, gently, gently. Okay, you need to take a little break from the position, take a little break from the position. And whenever you're ready, we are going to do one more round of that, so go ahead and help yourself back up. And again, arms around, palms on the insides of the feet, gently pulling those feet away so that you're really externally rotating here in the knees as much as you can. And then I'm going to scoop my bum forward just a little bit. So now I want to work in a little bit more flexion. You don't necessarily need to do that. Yeah, I'm just doing that for myself. But feel free to try it out and see how it feels. We've got the timer on, by the way. We're 15 seconds in. We have 1 more minute passive stretch, or 45 seconds more passive stretch, and then 1 more round of our pills and reels. Okay. Nice deep breath in. Exhale, relax. So it's not totally a passive position since you're having to create the tension on the arms to hold the feet up, right? And the ankles to actively flex up. But try and relax as much as you can. Good, we're almost there, yeah? Just a few more seconds. If you can go deeper, go ahead and feel free to do so. And about now, we're 1 minute, so go ahead and take a nice deep breath in. Pack that air down into your belly. Everything squeezes, and we're going to push those feet very gently at first, very, very gently. Push those feet into the hands. Push a little bit more. And a little bit more. We're doing a longer pales effort here. Good, keep pushing. Now find a strong effort. Yeah, make sure everything still feels okay, no pain, nothing weird. Push. And hold as much as you safely can. 3, 2, 1. Now rails, we're gonna pull away. So try and externally rotate even more as if you could escape the hands by squeezing that shin bone out away from you. Pull even more, you should be a medium effort now. Dial it up super slowly, yeah? You need to give your brain time to figure out what's going on. Okay, and about now you should be at your hard effort. And hold it. 2, 1. Very nice. Relax. Go ahead and gently move things around for a second, however you need to. And then whenever you're ready, we are going to do internal rotation as well, but for this, I'll get us to do one side at a time just because we end up in this kind of weird crisscross applesauce pretzel situation. And I think it's a little bit easier, especially if it's your first time, to just do one side at a time. Yeah, so whenever you're ready, we are going to do internal rotation. So I need to keep this foot flexed up. This is going to be even more important now because when you go into internal rotation, the number one cheat is that people like to go dump into the ankle like this, right? So if your ankle is inverting, meaning it's rounded here on the outside, some of that force is going to spill down into the ankle, and we're trying to work the knee, right? That's the whole point. So I want to keep the force where I'm trying to actually work so that it's doing what I want it to do. So this is going to be more important now. We're still going to use our hand, but now the opposite hand is going to come around, palm facing down, and grab the outside of that foot. Same thing, I'm just going to pull in, and you're going to find the end of where you can internally rotate with that shin bone without that ankle rounding. Okay, so play around with that for a second. I get our stopwatch ready. And again, here you might play also around with the degree of flexion, right? So you might feel it more out here, or you might feel it more up here. This is for you to figure out where you want to work. So you should have your position now, and we're going to start the timer. So try and relax. I'm going to work actually a little bit deeper here. Because for me personally, a lot of the issues, the knees were a big issue for me before. And it's always when I'm deeper in flexion that I feel what I need to feel. You know, it feels pretty disgusting. And so I know that that for me is where I need to be. Okay, we're 30 seconds in. We've got 2 minutes here. We're gonna do the same like we did with the other one. 2-minute stretch, we chill, tails and rails. 1 more minute, we chill. 1 more round of tails and rails, yeah? Go ahead and connect with your breath. Try and relax as much as you can. And if you do have issues with the knees, yeah, your maximum effort, I know I talked about this already in one of the introductory videos, yeah, but your maximum effort might be 2%. Okay, so you're starting from the least possible effort and really slowly working your way up. So be super careful, yeah? Even if you don't have any issues with the knees, just because it's a pretty unfamiliar place for people to work, it's probably new for your brain, right? So we need to give it a little bit more time to figure out what's going on. So we're at about 1:30 now. We've got 30 seconds left. And if you find you can go deeper, go deeper. When we're doing the internal rotation, you will probably feel more of the sensation here on the outside of the knee. Yeah, and the external, we feel it on the inside, and the internal, we feel it on the outside. Okay, so go ahead and get ready. We're gonna take a nice deep breath in. We exhale, we create tension, and now, same like I did before, I'm gonna push the outside of that foot now into that hand. Super, super gentle at first, yeah? Just try and understand what the contraction is. Push a little bit more. And dial it up super slowly, yeah? It's nothing's actually gonna move. Make sure your foot doesn't actually move, yeah? Keep pushing. You've got 10 more seconds. All right, dial it up even more. And about now, push as much as you safely can, and we're gonna hold it. 3, 2, 1. Now, rails, you're gonna try and internally rotate even more. Nothing will actually move, or if it does, only barely, barely. You're gonna try and escape that hand with the foot by internally rotating. You can also do this with your hands to try and get your brain to figure out what you're asking it to do. Pull in, keep an eye on that ankle, make sure you keep the foot flexed up, and hold it. Now, maximum safe effort for 3, 2, 1. Very nice. Relax. You can come out for just a second if you need to, yeah? And I'll suggest that anytime you come out, you immediately start to rotate. Yeah, very gently in either direction, like a couple little capsular cars. And we're gonna do 1 more round. Yeah, so whenever you're ready, opposite hand outside of that foot. Go ahead and very gently crank that foot in to find your maximum internal rotation of the knee. And we chill. Keep an eye on your ankle, keep an eye on your breath. These can be really nice to do in the gym. I actually prefer to do them blocking out the side of the foot with a weight. You could use a kettlebell or something and have the foot flat on the floor. This is a really nice way to do this. Maybe we'll try that in another video. But for those of you who don't have any equipment at home or don't have access to a gym, this is a really nice little setup that you don't need anything for, right? So we've got 20 seconds left. Keep an eye on that ankle. Make sure that foot is totally flat. A few more seconds. Good, and let's take our last deep breath in now. On the exhale, we solidify everything. We make sure we're at end range, and we're just very, very gently gonna push that foot into that hand. Start with a super light effort. Make sure it doesn't actually move, and then you're gonna push a little bit more. And a little bit more. Find a medium effort now. And build it up now to a strong effort. And I want you to hold it there for 3, 2, 1. Let's switch. Pull in. Make sure you're not using that ankle. Foot stays flexed up. Foot stays flat. You're pulling in. Yeah, if you need to use that hand or the opposite hand to help encourage your brain to figure out what's going on, what you're trying to ask it to do. Pull in even more. And ramp that effort up slowly. I want you to find your strong effort about now. Pull in and hold it for 3, 2, and 1. Very nice. Relax. You can come out. You can do a couple gentle capsular cars. Ooh. It's good for me to do this class also because I can never get enough knee stuff. Okay, good. Whenever you're ready, we move to the other side, yeah? So base yourself out. As well, if you're not comfortable sitting like this, feel free to adjust this leg. Yeah, you don't need to be in that same seated position the whole time. So I'm gonna go ahead and find now my internal rotation on this other knee. Okay, make sure I've got the opposite hand around the outside of that foot. I flex the foot up, my foot is totally flat, and now I'm gonna screw this bone in as much as I can manage without anything being painful or weird. Well, it might be a little bit weird, to be fair. It might actually be a little bit weird, but as long as it's not painful, yeah, then we should be okay. Sensations that are fine here, the timer is on by the way, sensations that are fine are pulling sensations, stretching sensations, possibly even almost like, not a twinge, but yeah, like a little pulling sensation. Yeah, again, you're looking now, you might feel it on the outside of the knee. And it's okay if you don't feel much here, because a lot of times when we don't have a lot of experience in an area, then it's hard for us to feel there, right? We don't have good connection with the brain. So it might be quite possible that you don't actually feel a whole lot, but when you do the pails and rails, you should feel something more, right? But as long as you're in a position where you're not able to pull that foot away from that hand, you are in the correct position. Yeah, so we're still working at end range, even if you don't feel a stretch. Okay, we're 1 minute in. As you can see, I've sent my other leg forward because I was tired of sitting in that position. We've got 45 seconds left, yeah? So keep an eye on that foot. Keep it flat. Lord knows that ankle's gonna try and do stuff. 30 seconds left. Keep breathing, 20 seconds left. All right, so just a reminder, the pails effort is me pushing away as if I wanted to do this, and the rails effort is me pulling in as if I wanted to escape that hand, all right? So take one more nice deep breath in. On the exhale, create tension in the whole body. We're focusing all of our attention on this knee, and I'm gonna start to very gently and very carefully push the outside of that that foot into my hand. And we're gonna build that effort up very slowly and very carefully, keeping an eye on the sensations at all times. Push a little bit more, you should be at your medium effort now. Keep breathing. Strong effort now, and I want you to hold it. 3, 2, 1. Now we're gonna switch. Make sure that foot stays flexed up. Don't let that ankle do the work. You're gonna try and pull it in as if you wanted to escape that hand by internally rotating even more. If you need to use your hands to do this, that's also totally fine. Pull, don't let that ankle move. Medium effort. Good, and about now, hard effort. Pull as much as you safely can. Let's hold it. 3, 2, and 1. Very nice. Very gently, very carefully. Ooh, feel that. You might also, this is important, you might also feel this a lot in the front of the ankle since you're working so hard to keep it flexed up that whole time. Yeah, so you are gonna feel some of that in the ankle. That's also okay. Nothing to worry about as long as it's not painful, as always, yeah? Go ahead and set yourself up. We're gonna do 1 more minute and 1 more round. Oof. And I feel it on this side. I actually did these earlier this week. So I'm still feeling it from then. And I did some other knee stuff yesterday as well, so she's feeling it. Okay, we're 10 seconds into our new stretch. So go ahead and chill, yeah? So yeah, it is normal. Most people actually, when I'm teaching stuff for the knees, they complain more about the front of the ankle than the knee itself. So this is totally fine, yeah? As long as there's nothing painful going on, you will feel it there in the front of the ankle. Yeah, just at the top of the foot. So we've got 20 seconds left. Fifteen seconds. Good. Almost there. So go ahead and take a nice deep breath in. You know the drill now. On the exhale, you solidify. You very carefully find that effort. Push the outside of that hand, or push the outside of that foot into your hand. Super light and gentle for now. Push a little bit more. It's kind of an exploration exercise. Yeah, you're really, really carefully, slowly looking for where you can push safely. All right, you should be about now at a pretty strong effort. Yeah, I want you to push as much as you safely can. You're gonna hold it now for 3, 2, 1. Very nice. Switch rails. Try and escape that hand by pulling in with the knee. Yeah, you're gonna feel that ankle also. It's okay. Pull in. Ooh, build it up slow. I feel it too. I feel it too. Let's go. Pull, pull, pull. And maximum safe effort about now. Pull as much in as you possibly can. Watch that ankle that it's not rounding. Let's go. 3, 2, and 1. Ooh. My gosh, spicy. Okay. So all of our hard work is done. All right. All that's left to do is to save our work with our cars. Okay. So we'll do our cars for the hips first. Yeah, since we just got a lot of work with the knees and the ankles. I'm gonna do my cars from a quadruped position. If this is not comfortable for your knees, feel free to roll up the mat or to place a towel or something there. And you wanna think about having your hands under your shoulders, your knees under your hips, okay? And what we don't want here is we don't wanna lean or twist or shift our weight too much side to side. You wanna imagine like you have a hot cup of coffee on your back. And if it helps you, you can place a block just on your lower back so that nothing moves, okay? You really need to focus on keeping everything nice and still so only that hip is doing the work, all right? Let's get ready. Squeeze that leg up. Squeeze it towards your chest. We're just gonna do 3 in each direction, yeah? Squeeze it up as much as you can. Out to the side. Here's where you really need to watch for twisting in the spine. It's gonna be smaller than where you think you can go, yeah? Internally rotate. Legs come together. Now you're gonna brace in the abs, push up with the foot so that you're not dumping into the spine, yeah? Squeeze your abs, push up, you should feel the glute. We go out to the side. Okay, nice and slow. There's a 1. This will be 2. Go out. There's a pop. Internally rotate, brace, push up. I'm bracing the whole time, but I'm mentioning it specifically before the extension because that's where everyone loves to arch their back. Yeah, up, out. So it's just a little reminder to check in with what your abs are doing and what your spine is doing before you go into that position. You're gonna drop the block sometimes, that's okay, yeah? I'll go to the other side, we do 3. Hands under your shoulders, knees under hips. Make sure they're not too close or too far apart, yeah? Here's my hot cup of coffee. Imaginary. You don't need to use the block, yeah? It's just there to help you with the spinal awareness stuff if you're not sure what your back is doing yet. Okay, let's go. Knee up, out to the side. I'm looking for the end of where I can go, yeah? Rotate in, make sure the abs are nice and tight. You push up, feel that glute, out to the side. Bring that knee up as high as you can, and then you come back down. There's a 1. Internally rotate, push up. Don't let that back move. Because the back can't move, or shouldn't be moving, you're gonna feel like the circle is smaller than what you're actually able to do, but that's because this is what your hip is able to do by itself, right? We're so used to moving things together that we don't have always a very good idea of what each joint can do on its own. So that's kind of the whole point of doing this work, right? So our hips are done. Let's go ahead and do our knee cars again. I'll do them just from a normal position since this is kind of a standard practice video here. So again, same arm under, grab that opposite bicep, other hand on top. We'll start with external. We're just gonna go 3 each way, all the way up. Internal, watch that ankle, squeeze all the way down. You need to watch the ankle also when you're doing these, yeah? You'll feel the front of the ankle working because you're fighting to keep it flexed up. Let's go, this will be 3 in this direction. So when I get to the bottom, I'm gonna keep it internally rotated. I go all the way up, externally rotate, squeeze that as I come all the way down. There's another pop. Internally rotate up, externally rotate down for 2, up, out, and down for 3. Actually, we'll do our ankles while we're here as well. So go ahead and make 3 big circles, nice and slow in each direction. 2 and 3, and then we'll go the other way also for 3. 2 and 1. Yeah, I know that we didn't specifically work on the ankles, but it helps the brain to figure out which thing is supposed to do what, so that when we do save the work for the knee and for the hip, it's also like, okay, that's my ankle, right? So other side, same arm, find your position, flex that foot up, externally rotate, we go all the way up, all the way in, and all the way down. I kind of lost my external on that. Here we go. 2. That's what happens when you're talking and doing it at the same time. Sometimes you mess it up. In. Okay, we go the other way, up, out, all the way down for 3, 2, and 1. Very nice. We stay here. We make 3 circles with our toes. Point. I'm gonna feel your ankles after all that knee stuff. 3, very nice, other way. Notice your foot wants to draw kind of more like a triangle than a circle. That's okay. All the way down and all the way up. Beautiful. Okay, so that is us done for the day. Thank you so much for joining this class, and see you again soon.